In this video, I want to give you a very clear step-by-step path to solving why you have fatigue. You, like so many others, are so tired and so low on energy, you need a double espresso just to function every day. And you're not alone, and in this video, I want to walk you through a step-by-step diagnostic checklist to drill down to the cause of your fatigue. Because here's the frustrating part. You know you're tired, and you know you have no energy, so something must be off, but your labs are normal, and your doctor says, everything looks fine. So you're told to get more sleep. You're told to try a new supplement. You're told to push through. But fatigue isn't fixed by guessing or by energy drinks or the latest biohack that you saw online. Solving the fatigue puzzle means thinking clearly and logically in a stepwise fashion, like a detective with a checklist. You rule one thing out, you rule another thing out. You move on one by one, you look for patterns, and you order the right tests. And that's what this video is all about. I'm going to walk you through the same structured framework that I use on my patients in my clinic every day who are suffering from fatigue, low energy, or being tired, however you want to say it. So we're going to use this analogy of a battery, and it's going to be made up of 7 different energy systems. And if even one of those is off, fatigue can start to manifest. So let's bring this battery online and go through it, one module at a time. We're going to start with anemia. Now, anemia means you don't have enough red blood cells or you don't have enough hemoglobin. One of their main roles is to deliver oxygen to your cells. Now, most cells need oxygen to function, like a plant needs carbon dioxide to function. And if you're anemic and your oxygen carrying capacity drops, so your energy tanks. Of course, you're going to be fatigued. And anemia is way more common than people think. And honestly, I'm still surprised how often a patient will come to me with labs from a previous provider and anemia is clearly there, but it was never mentioned to the patient. And anemia isn't just one thing. It's not just one entity, right? Sure, there's iron deficiency anemia, that one most people have heard of, but there's also B12 deficiency, folate deficiency, anemia of chronic inflammation, which is actually the second most common type of anemia. And there's many more that I'm not going to bore you with, but the good news is that it's not hard to figure out what kind of anemia you have and to fix it. Because without enough oxygen, your cells are going to struggle and you're going to have low energy, period. So let's move on to the thyroid. You have to check your thyroid, right? Fatigue can easily be caused by your thyroid gland not functioning properly. Your thyroid gland is your body's sort of metabolic thermostat, right? It controls how fast or how slow everything runs. And roughly 1 in 10 people has a thyroid issue, including something called subclinical hypothyroidism, which doesn't always show up clearly on standard labs. And that's part of the problem. In my experience, just testing TSH and T4 often misses the picture. You've got hypothyroidism, you've got Hashimoto's thyroiditis, but you've also got poor conversion of T4 to T3, you've got high levels of reverse T3, you've got iodine deficiency, and they all matter and they all need to be checked. I'm going to be doing a full video on thyroid soon, so stay tuned for that. Let's move on to infections. Now, chronic infections are, again, way more common than people realize. And if you have a chronic infection, you're most likely going to be tired and fatigued. Lyme's disease, Epstein-Barr virus, post-COVID fatigue, even hidden gut infections, which is what I see most often because when I evaluate someone for fatigue, I don't stop at blood work. If we're not finding anything on blood work, I also run stool tests. Why do I do that? Because I consistently find parasites, bacterial overgrowth, and other infections that most people had no idea were there. And what most people don't realize is that you don't have to have diarrhea or bloating to have a gut infection. A lot of the time, there is 0 digestive symptoms, but those microbes can quietly drain your system like a background app on your phone that's quietly running up and chewing the battery without you ever noticing. So let's move on to metabolic dysfunction or insulin resistance now. Remember how we said every cell needs oxygen? Well, they also need fuel, And guess what not enough fuel causes? Fatigue, right? And for a huge portion of the population, the fuel delivery system isn't working right. Studies show 50 to 60% of adults have either insulin resistance, metabolic syndrome, type 2 diabetes, or something called LADA, which is an acronym for latent autoimmune diabetes in adults. And unfortunately, most of it goes undiagnosed due to limited or outdated testing. I've covered this more in detail in other videos, so I'll put a link to those videos in the description if you want to dive deeper. Now, hormones are kind of like the internal messengers that tell your body how to repair, how to rebuild, how to recharge. And when those signals get disrupted, even slightly, fatigue shows up. So in women, this could be due to perimenopause, menopause, PCOS, or heavy menstrual bleeding. That also would lead to iron loss, right? Which would mean iron deficiency anemia. But in men, it's often low testosterone. But testing for low testosterone alone doesn't tell you much. You also need to look at free testosterone, as well as luteinizing hormone, sex hormone binding globulin. And all too often, those parts get skipped. Hormone imbalances are often chalked up just to, aging. But they're measurable and they're fixable. And you don't have to guess, right? You can test, and you should. All right, so let's move on to sleep, which seems obvious, right? If you're not sleeping well, of course you're gonna feel tired. But here's the thing. A lot of people have sleep apnea, and they don't know it. You don't have to snore to have sleep apnea. You don't have to be overweight to have sleep apnea. If you're waking up in the morning and you're not feeling refreshed, it's worth looking into. But obviously there's, insomnia, waking up multiple times a night, or nocturia, which means, getting up to pee multiple times a night, which creates fragmented sleep. Now, if you're waking up to pee that often in the night, that could be a separate issue altogether. But we also have restless legs that keep people up. We have shift work people. We have people who travel a lot, which disrupts their circadian rhythms. Sleep is a big deal, and no amount of coffee can compensate for poor sleep. So next up, we have mental health. Now, a lot of people wouldn't associate mental health with fatigue, but depending on the study, somewhere between 18 to 45% of fatigue cases are tied to mental health. And there's a physiologic reason for it called the HPA axis, right? The hypothalamic pituitary adrenal axis. That's the system that sort of controls your cortisol and your stress response. And that can get completely dysregulated under chronic stress. But if you think about it, when you first start dating someone, you feel completely energized, right? You can't wait to see that person. Or let's say you have a big vacation coming up and you're really excited about it. You can't wait to get out of bed and get going, like a kid on Christmas morning, right? That's mental health giving you fuel. But the opposite is true. Depression, anxiety, burnout, those can drain your energy levels. If you're lacking motivation, that's a sign. If you're overwhelmed or just white knuckling it through your life, please get some help. Whether it's mindfulness apps, which are really common, online counseling, which are really common these days, or even in-person therapy. This is one of the most fixable parts of fatigue and the one that's probably the most ignored. Now, that concludes the battery part, but I want to mention some honorable mentions before we go on. Because fatigue isn't necessarily always from a diagnosis that shows up on a lab test. Sometimes you're tired just because your body's not being taken care of. Certain medications like beta blockers, antihistamines, or antidepressants, they can drag your energy down. A poor diet full of ultra-processed food, it's not exactly fueling your mitochondria. And chronic pain can also wear you down, right? If you've ever had chronic pain, it's exhausting, even if you're mentally toughing it out. And then let's not forget about nutrient deficiencies, right? Especially things like magnesium, B vitamins, things like CoQ10. None of these are exotic, but they're common, they're overlooked, and they are real contributors to fatigue. But also, sometimes there's nothing quote unquote wrong with you. I mean this with all the love in the world. Sometimes you're just out of shape, right? If your mitochondrial health is in the tank because you haven't exercised in years, right? That could be part of the problem. If you're on your 4th consecutive Netflix binge and you haven't lifted anything heavier than a sandwich in 3 years, your fatigue isn't exactly a mystery. But now that you've seen this whole module of the battery and the honorable mentions, take a step back and look at the big picture. Fatigue rarely comes from a singular issue. It could be if it's really bad, but it usually is a few different systems, each draining the battery just a little bit more, right? And the key is working through them logically, testing, ruling things out, and restoring balance one step at a time. And that's when people actually finally start to feel like themselves again. So the point of this video wasn't to just throw a bunch of diagnoses at you. It was to show you that fatigue has to be approached logically, right? Step by step, not randomly, and definitely not emotionally. You need a framework. You need to be able to say, I've ruled this out, but I still need to look at that. And that's how people actually get better. So if this helped clarify your thinking, or made you realize that you've skipped a few steps, hit that subscribe button and don't miss what's coming next.